Hey, it's Adam Sewell, MD. Welcome to section 4.6 of the Microplastics Toxicity Training, certified by the Microplastics Health Alliance. In this final section of Module 4, we're going to focus on one of the most important skills in clinical medicine, differential diagnosis. When patients present with nonspecific symptoms like brain fog, fatigue, hormone irregularities, GI issues, or immune dysregulation, it's our job to rule out life-threatening or progressive conditions first, before settling on a diagnosis like microplastic-related toxicity. This module helps you confidently rule in or rule out mimickers and recognize when to escalate workup or refer out. Part 1. The Clinical Challenge, Overlapping Syndromes. Microplastic toxicity can present across many systems: neurological, endocrine, immune, gastrointestinal. But here's the catch. It shares its symptom profile with dozens of other conditions, from autoimmune disease to mold illness, chronic infections, psychiatric disorders, and even malignancy. As physicians, we must be thorough but efficient. This means pattern recognition, appropriate testing, and knowing when red flags warrant additional evaluation. Part 2. Top 5 conditions that mimic microplastic toxicity. 1. Autoimmune disease. Symptoms like joint pain, fatigue, rash, and malaise can be seen in early lupus, Hashimoto's, or Sjögren's. Overlap with microplastic-related immune activation is high, especially since some plasticizers, for example BPA, phthalates, and benzophenin 3, have been shown to increase autoantibody production. Christine G. Parks et al., 2022, Frontiers in Immunology. Key labs to rule out: anti-nuclear antibody with reflex, anti-double-stranded DNA, SSA or SSB, thyroid peroxidase or thyroglobulin antibodies, erythrocyte sedimentation rate, C-reactive protein, C3 or C4 complement levels, red flags, butterfly rash, Raynaud's, oral ulcers, swollen joints, uveitis, unexplained cytopenias. 2. Mold-related illness or CIRS, chronic inflammatory response syndrome. Symptoms include memory problems, fatigue, sinus congestion, hypersensitivity to smells, skin rashes, and static shocks. Overlap, systemic inflammation, brain fog, hormonal shifts, GI permeability, common in patients with poor ventilation, water damage, or work in older buildings. Key labs to consider: HLA-DR haplotyping, susceptibility, transforming growth factor beta-1, matrix metalloproteinase 9, C4a, visual contrast sensitivity test, VCS, mycotoxin urine panel, vibrant, mosaic, real-time. Red flags: symptoms worsen in specific environments, resistant to typical detox or hormonal therapy, sudden onset after environmental change. 3. Heavy metal toxicity, lead, mercury, arsenic, cadmium, presents with fatigue, GI symptoms, neuropathy, hair loss, mood instability. Metals like microplastics interfere with mitochondrial function, oxidative phosphorylation, and neurotransmitter production. Key labs: urine heavy metal panel, provoked and non-provoked, hair mineral analysis, whole blood mercury/lead, red flags, history of fish heavy diet, mercury, occupational exposure, welding, batteries, construction, abnormal tremors, gait instability, nephropathy. Clinical reference: Navas Asian et al. 2009 found that even low-level blood cadmium and lead exposures were significantly associated with chronic kidney disease in U.S. adults. Chelation: harnessing and enhancing heavy metal detoxification, a review by Margaret E. CIRS, The Scientific World Journal, 2013. 4. Lyme disease and co-infections can present with neurological and endocrine symptoms, migratory pain, POTS-like symptoms, mood instability. Common co-infections include Babesia, Bartonella, Ehrlichia, and Anaplasma. Key labs: Lyme Western blot, CDC plus I gene X interpretation, CD57 NK cell count, tick-borne co-infection panel, inflammatory cytokines, interleukin-6, tumor necrosis factor alpha. Red flags: history of tick bite or rash, even if years ago. Sudden onset of multiple systemic symptoms. Symptoms worsen with immune modulation or hormone therapy. 5th, psychiatric or neuroendocrine disorders. Conditions like depression, anxiety, PTSD, or perimenopausal mood disorders can mimic or exacerbate symptoms attributed to toxic burden. Endocrine axes, HPA, HPT, HPG, must be fully assessed before attributing symptoms to environmental factors alone. Recommended evaluation: morning cortisol plus adrenocorticotropic hormone, salivary cortisol rhythm if available, dehydroepiandrosterone sulfate, thyroid panel, thyroid stimulating hormone, free T3, reverse T3, Beck depression inventory, patient health questionnaire -9, generalized anxiety disorder 7-item scale. Red flags: suicidal ideation, hallucinations, new onset panic, significant weight loss or gain greater than 10% in 3 months, cognitive decline not proportional to labs or imaging. Part 3. Using the Microplastics Health Alliance MHA algorithm with differential diagnosis. When you suspect microplastic burden, start with the MHA Clinical Screening tool, especially in patients where conventional labs are negative or symptoms span multiple systems. If MTI score is high, greater than 30, rule out life-threatening or progressive illness with CBC with diff, CMP, ESR or CRP, ANA with reflex, TSH or free T3, heavy metal screen, mold or Lyme evaluation as indicated. Then confirm microplastic burden with urinary BPA and phthalates, hormonal panels, estradiol, testosterone, SHBG, DHEA, oxidative stress markers, 8-OHDG, GGT. You can document in your chart that more serious causes ruled out and proceed with exposure reduction and detoxification safely. Part 4. Red flag symptoms that require immediate referral or further workup. Neurological, rapid memory decline, unexplained seizures, gait abnormalities, endocrine, hypercalcemia with confusion, rapid thyroid swelling or pain, hematologic, unexplained anemia, pancytopenia, GI, unintentional weight loss with GI symptoms, bloody stool or persistent vomiting, dermatologic, non-healing lesions, vasculitis like rashes. Remember, microplastic toxicity is real, but it is never an excuse to miss cancer, autoimmune disease, or serious infections. Rule out red flags first, then build your environmental medicine strategy with confidence. To summarize, this module has walked you through the most common and clinically important mimics of microplastic toxicity. Your job as a clinician is to distinguish overlapping conditions, methodically, compassionately, and scientifically. Start with the MHA screening tool, layer in conventional diagnostics, and always remain vigilant for signs that something more urgent is unfolding. Environmental illness is complex, but with structure, scoring tools, and solid clinical judgment, you can help patients feel seen, supported, and finally on the path to recovery. This concludes Module 4. In the next module, we'll shift our focus to treatment strategies, how to reduce exposure, support detoxification, and monitor outcomes. I'll see you there.